Your blood type isn't just a medical label on your donor card. It's a genetic fingerprint that influences how your body fights disease, processes nutrients, and responds to infections in ways that most people never realize. What flows through your veins carries ancient evolutionary signatures that can predict your susceptibility to heart disease, cancer, and even mental health conditions with startling accuracy. The connection between blood type and health reaches far deeper than transfusion compatibility. Each of the major blood groups evolved under different environmental pressures, leaving modern carriers with distinct biological advantages and vulnerabilities that shape their entire medical profile. Understanding these patterns can transform how you approach prevention, treatment, and lifestyle choices throughout your life. Type O blood dominates the global population for good evolutionary reasons. Its carriers developed enhanced resistance to certain parasitic infections that plagued early human settlements, particularly those transmitted through contaminated water sources. This protection came at a cost, however, as Type O individuals show consistently higher rates of peptic ulcers caused by Helicobacter pylori bacteria, the same stomach acid production that helped ancestors survive harsh diets now creates an environment where this particular pathogen thrives, leading to inflammation and tissue damage that can persist for years without treatment. Cardiovascular health reveals another striking pattern in Type O carriers. Their blood contains naturally lower levels of von Willebrand factor and factor VIII, proteins essential for clotting. While this reduces the risk of dangerous blood clots that cause heart attacks and strokes, it also means that bleeding episodes can be more severe and prolonged. Emergency medical teams have learned to monitor Type O patients more carefully during surgery and trauma care because their blood doesn't seal wounds as efficiently as other types. Type A, blood tells a different evolutionary story entirely. Its carriers appear to have adapted to agricultural societies where close living conditions and grain-based diets created new health challenges. The A antigen provides enhanced immune recognition against certain bacterial infections that spread rapidly in crowded settlements. This advantage helped farming communities survive epidemic diseases that devastated hunter-gatherer populations with different blood types. Modern research reveals that Type A individuals face significantly elevated risks of cardiovascular disease compared to other blood groups. Their blood tends to be more viscous, meaning it flows less easily through narrow vessels. This thickness, combined with higher baseline levels of clotting factors, creates conditions where arterial blockages form more readily. Heart disease mortality rates among Type A populations consistently exceed those of Type O groups by margins that cannot be explained by lifestyle factors alone. The relationship extends to cancer susceptibility in ways that continue to surprise medical researchers. Type A carriers show markedly higher rates of gastric cancer, particularly in populations with diets high in preserved meats and low in fresh vegetables. The mechanism appears linked to how A antigens interact with certain carcinogenic compounds, creating cellular environments where malignant transformation occurs more frequently. This pattern holds true across different ethnic groups and geographic regions, suggesting a fundamental biological connection rather than environmental coincidence. Type B blood presents its own unique health profile shaped by evolutionary pressures in Central Asian populations. Carriers demonstrate altered immune responses to viral infections, often showing either enhanced resistance or increased severity, depending on the specific pathogen. This variability reflects the diverse disease landscape that bee populations encountered as they migrated across vast continental regions with different infectious agents. Neurological health shows intriguing connections to Type B blood that researchers are still working to understand fully. Some studies indicate higher rates of cognitive decline and memory disorders in aging bee carriers, while others suggest enhanced recovery from certain types of brain injury. The mechanisms remain unclear, but they appear related to how B antigens influence inflammation in nervous tissue and the blood-brain barrier's permeability to various substances. Type A B blood, being the newest and rarest major blood group, carries health implications that blend characteristics from both A and B types, while adding unique elements. AB carriers often show the highest levels of factor VIII and von Willebrand factor, making them extremely prone to clotting disorders. Pulmonary embolisms and deep vein thromboses occur at rates significantly above population averages, requiring careful monitoring during periods of immobility or hormonal changes. The cancer patterns in type AB individuals create a complex mosaic of risks and protections. While they share some gastric cancer susceptibility with type AI carriers, they also demonstrate enhanced resistance to certain liver cancers that affect other blood groups more severely. This protection appears linked to how AB antigens interact with hepatitis viruses and other liver pathogens, creating immune responses that clear infections before they can establish chronic inflammation. Mental health connections to blood type represent one of the most controversial yet consistently documented areas of research. Type A, B individuals report higher rates of anxiety and stress-related disorders across multiple population studies. The biological basis for this connection remains speculative, but some researchers propose that the dual antigen system creates more complex immune responses that influence neurotransmitter production and stress hormone regulation. The Rh factor adds another layer of health implications that intersect with ABO blood groups in significant ways. Rs-positive individuals generally show enhanced immune responses to bacterial infections, but increased susceptibility to certain autoimmune conditions. The Rhd protein appears to influence how immune cells recognize foreign substances, creating patterns of overreaction or underreaction that affect everything from allergies to organ transplant success rates. Rh-negative carriers face unique challenges that extend beyond the well-known pregnancy complications. Their immune systems often respond more aggressively to foreign proteins, making them more prone to severe allergic reactions and drug sensitivities. This heightened immune vigilance provides protection against some infections, while creating vulnerabilities in medical procedures that introduce foreign substances into the bloodstream. Metabolic differences between blood groups influence how bodies process nutrients and respond to dietary changes. Type O individuals typically show better protein metabolism and fat utilization, reflecting their evolutionary adaptation to meat-heavy diets. However, they often struggle with carbohydrate processing, showing higher rates of insulin resistance and metabolic syndrome when consuming modern high-sugar diets that differ dramatically from ancestral food sources. Type A carriers demonstrate the opposite pattern, with enhanced carbohydrate metabolism, but reduced efficiency in processing animal proteins and saturated fats. Their digestive systems produce different enzyme profiles that favor plant-based nutrients, while struggling to break down the heavy meat consumption that benefits type O individuals. This creates dietary requirements that align more closely with vegetarian or Mediterranean eating patterns for optimal health outcomes. The implications extend to medication responses in ways that pharmaceutical companies are beginning to recognize. Blood type influences how quickly drugs are metabolized, how effectively they bind to target tissues, and what side effects are most likely to occur. Aspirin provides cardiovascular benefits primarily to type O individuals, while showing minimal protective effects and increased bleeding risks in other blood groups. Similarly, certain blood pressure medications work more effectively in type A patients, while requiring dose adjustments or alternative choices for type B and AB carriers. Infectious disease susceptibility creates another crucial dimension of blood type health implications. Beyond the historical patterns that shaped blood group evolution, modern pathogens continue to show preferences for specific blood types that influence outbreak patterns and individual risk assessment. COVID-19 demonstrated these blood type vulnerabilities with startling clarity during the pandemic's early waves. Type A individuals consistently showed higher infection rates and more severe disease progression compared to other blood groups. The mechanism appears linked to how the SARS-CoV-2 virus binds to cellular receptors, with A antigens providing enhanced attachment points that facilitate viral entry into respiratory tissues. This increased susceptibility translated into higher hospitalization rates and longer recovery periods that persisted across different age groups and underlying health conditions. Type O blood provided measurable protection against COVID-19 infection and severity, confirming patterns observed with other respiratory viruses throughout history. The absence of A and B antigens reduces viral binding efficiency, while the natural antibodies present in O blood appear to neutralize certain viral particles before they can establish infection. This protection extended beyond initial infection to include reduced transmission rates, suggesting that type O individuals serve as natural circuit breakers in epidemic spread patterns. Malaria continues to shape blood type health outcomes in regions where the parasite remains endemic. Type O carriers show enhanced resistance to severe malaria complications, particularly cerebral malaria that causes neurological damage and death. The mechanism involves how parasitized red blood cells interact with blood vessel walls, with O blood cells showing reduced adhesion that prevents the dangerous clumping that blocks circulation to vital organs. This protection has maintained type O dominance in African populations where malaria pressure remains intense. Conversely, type A individuals face increased malaria severity when infected, with higher rates of organ failure and prolonged illness. The A antigens appear to enhance the binding between infected cells and vascular surfaces, creating the exact conditions that type O blood naturally avoids. This vulnerability helps explain why type EI frequencies remain lower in malaria endemic regions, despite potential advantages against other diseases. Norovirus outbreaks reveal another layer of blood, type-specific susceptibility that affects millions of people annually. The virus shows strong preferences for certain blood group antigens, with type B and AB individuals experiencing more frequent and severe gastroenteritis episodes. The mechanism involves how viral particles attach to intestinal cells, using blood group substances as molecular anchors to establish infection. Type O carriers often remain asymptomatic, even when exposed to the same viral strains that devastate other blood groups. This pattern extends to other gastrointestinal pathogens, including cholera, where type O individuals face dramatically higher risks of severe dehydration and death. The cholera toxin binds more effectively to the exposed H substance present on type O red blood cells, creating more intense fluid loss that can prove fatal without rapid medical intervention. Historical cholera pandemics show clear patterns of differential mortality based on blood type distribution in affected populations. Autoimmune diseases demonstrate complex relationships with blood type that influence both susceptibility and disease progression. Type A carriers show elevated rates of rheumatoid arthritis, with their immune systems more prone to attacking joint tissues through molecular mimicry mechanisms. The A antigen shares structural similarities with certain joint proteins, creating confusion in immune recognition that leads to chronic inflammation and tissue destruction. Multiple sclerosis affects blood groups differently, with type B individuals showing earlier onset and more aggressive disease progression. The mechanism appears related to how B antigens influence the blood-brain barrier's permeability and immune cell migration into nervous tissue. This creates environments where myelin destruction occurs more rapidly, leading to faster accumulation of neurological disabilities. Type A, B blood, presents unique autoimmune challenges that combine elements from both A and B patterns while adding novel vulnerabilities. Carriers show higher rates of systemic lupus, erythematosus, and other multi-organ autoimmune conditions that affect connective tissues throughout the body. The dual antigen system appears to create more opportunities for immune confusion and cross-reactivity that triggers widespread inflammatory responses. Diabetes susceptibility varies significantly across blood groups in patterns that reflect both genetic predisposition and metabolic differences. Type B individuals show elevated risks of type 2 diabetes, particularly when combined with certain dietary patterns that stress their carbohydrate processing systems. Their insulin sensitivity differs from other blood groups, requiring earlier intervention and more careful monitoring of blood sugar levels throughout life. Type A carriers demonstrate different diabetes patterns with enhanced sensitivity to dietary fats that can trigger insulin resistance through inflammatory pathways. Their diabetes often presents with cardiovascular complications that develop more rapidly than in other blood groups, requiring integrated management approaches that address both conditions simultaneously. Pregnancy complications extend beyond the well-known Rh factor issues to include ABO-related risks that affect both maternal and fetal health. Type O, mothers carrying type A or B babies, face increased risks of hemolytic disease, where maternal antibodies attack fetal blood cells. This can lead to severe anemia, jaundice, and neurological damage in newborns, requiring careful monitoring and sometimes intrauterine transfusions to prevent permanent harm. The opposite pattern creates different challenges, with type A or B mothers carrying type O babies showing increased rates of pregnancy-induced hypertension and preeclampsia. The mechanism involves immune recognition of fetal blood cells that differ from maternal type, triggering inflammatory responses that affect placental blood flow and maternal cardiovascular function. Blood type influences wound healing and surgical outcomes in ways that surgical teams are beginning to incorporate into treatment protocols. Type O patients often experience faster initial healing but higher risks of keloid scarring, while type A individuals show slower healing with better cosmetic outcomes. These differences affect everything from surgical technique selection to post-operative care protocols and expected recovery timelines. Cancer treatment responses vary significantly based on blood type, influencing both chemotherapy effectiveness and radiation sensitivity. Type A patients often require dose modifications for certain drugs due to altered metabolism and clearance rates, while type O individuals may need enhanced supportive care during treatment due to their bleeding tendencies and immune response patterns. Blood clotting medications reveal stark differences in how each blood type processes anticoagulant drugs like warfarin and heparin. Type A patients typically require lower doses to achieve therapeutic levels, as their naturally higher clotting factor concentrations amplify the drug's effects. Physicians must monitor these patients more frequently to prevent dangerous bleeding complications that can emerge suddenly, even with standard dosing protocols. Type O individuals present the opposite challenge, often needing higher medication doses to achieve the same anticoagulant effects. Their naturally lower baseline clotting factors mean that standard doses may provide insufficient protection against thrombosis, leaving them vulnerable to stroke and pulmonary embolism despite apparent compliance with prescribed regimens. Emergency departments have learned to adjust protocols based on blood type when treating acute clotting events. Organ transplantation success rates show unexpected correlations with blood type beyond simple compatibility matching. Type A, B recipients demonstrate enhanced acceptance of organs from any ABO-compatible donor, but their post-transplant infection rates exceed other blood groups significantly. Their complex immune profile creates environments where opportunistic pathogens flourish, requiring more aggressive immunosuppressive protocols that further compromise natural defenses. Type O recipients show superior long-term organ survival rates when receiving compatible transplants, but their enhanced immune responses can trigger more severe rejection episodes during the critical first months. Transplant surgeons have developed blood type-specific protocols that adjust immunosuppressive timing and intensity based on these predictable patterns of immune behavior. Age-related cognitive decline affects blood groups through mechanisms that researchers are still mapping. Type B individuals show accelerated memory loss in specific domains, particularly spatial navigation and episodic recall, beginning in their 50s. Brain imaging studies reveal distinct patterns of atrophy in regions associated with these functions, suggesting that B antigens influence neurodegeneration pathways in ways that standard dementia screening often misses. Your blood type represents far more than a simple medical classification. It serves as a biological blueprint that influences your susceptibility to diseases, your response to treatments, and even how your body ages. These ancient genetic signatures continue shaping modern health outcomes in ways that medical science is only beginning to fully understand. Knowing your blood type's specific risks and advantages empowers you to make informed decisions about prevention, screening, and treatment that could dramatically impact your long-term health trajectory.